My name is Dr. Bill Lyle, and I practice obstetrics and gynecology in Pensacola, Florida. My residency was with the University of Florida, and when I finished my residency in 1999, the next step is, well, where am I going to practice medicine? And we looked at a lot of different opportunities, and the opportunity that we took was taking over the practice in Pensacola, which at that time was the largest provider of abortion services in Pensacola in the Florida Panhandle. So we took over the practice. We told the staff they're welcome to stay, but that there was one big change, that we would no longer be performing abortions, no longer referring for abortions. The staff was welcome to stay, but if they even referred somebody to another abortion clinic in Florida, that they would be terminated and they could pack up their bags that day. And over the years, the thousands and thousands of lives created in God's image at the moment of conception have been lost right here. We approached our pastor and said, hey, can I just do a presentation on a Sunday night for the congregation, let them know how we treat the preborn as patients, but also show them what an abortion actually is and what's going on in our own town. And he said, absolutely. So we did a presentation, had a great response. Other pastors called, they wanted to do a presentation. And that was really the birth of ministry of prolifedoc.org. Now we use the tools of modern medicine to really let the babies defend themselves. We want to show the ultrasound, 2D, 3D, 4D. We want to use MRI. We want to use fetoscopy, putting a camera, a GoPro essentially, inside the mother's womb and showing the baby and let the baby say, hey, this is who I am. We can not only show the person, but we can show the personality. But another emphasis is that we want to educate people, give them the tools to defend God's preborn in the womb. So if we can show that the preborn are patients, then they, by definition, they are persons. And if they are persons, then they have protection under the 14th Amendment. So yes, they are patients. If we are doing blood transfusions to babies at 18 weeks gestation, they're getting a blood transfusion that somebody donated to One Blood or the Red Cross, and we're saving the life of the baby. That's being a patient. But now we're doing open heart surgery, spina bifida corrective surgery, laser vascular surgery. A whole new field of medicine has opened up, treating the preborn as patients.